growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, this is Dr. Steve Rasner, and you're tuned into The Lionhearted once again. If you ever look at the titles of my podcast, I don't know if you guys do that or not, but this one's entitled The Most Important Podcast I've Ever Done. Now, I've only done these for 50 weeks, I was told the other day, so it's not even quite a year. And you've heard me say many times that as long as I think you're listening, I'll keep doing them. And so I continue to produce these. Let me get to tonight's, because if this is the only one you listen to, or if it's the first one you've listened to, I don't have it pre-planned totally, but I've got to share it with you. In fact, I want to tell you that I wasn't even going to do a podcast tonight. But this podcast is based on a conversation I had with a colleague of mine today. A dreadful conversation that reminds me of the price of freedom. In fact, everything I've talked about for the last year comes into play in this conversation. So let me give you the backstory and you'll understand it. What I'm talking about with you tonight is why it's so important, in my opinion. If you're presently an associate, then you don't have a clue what the real joy of being a dentist can be. In most cases, I have to say that. If you work, and I'm biased, I get it, but if you work in corporate dentistry, and look, man, you got to start somewhere. So if that's what you're doing, that's what I guess I would be doing if I got out of dental school in the last 5 years. I don't know. Either you know somebody in your family who could hire you, or you got to get a job, or you're in a post-grad program. I get it. But, I've been doing presentations for 20 plus years. And for the last 10 years, of course, I've met many, many dentists, many young dentists, of which are employed by corporate chains. And to be honest with you, I don't get the chance often during a presentation, even a break or a lunch, to have extended conversations to understand what that's really like. But man, I got a taste of it today. And it was even more haunting to me because of the following. I have a colleague who practiced for a long time. And he kind of fell down on his luck. And a lot of things went bad in his personal life that resulted in him losing his practice. A practice that he had many, many years. And this guy was a very good dentist. A very connected dentist. A very knowledgeable guy. He took abundant CE. And look, man, things happen in life. We all go through or can go through challenging times. And the challenging times he went through resulted in not having a practice and not even practicing for some time after doing it for years and years. So finally, he gets back into the game, which was not easy. I mean, he was on the border of not ever working again. And he needed to work. So unless he got into an entirely different profession, he was pretty vulnerable to the choices of his employment. Not that he got hired. This is another caveat to share with you. He didn't get hired by some slumlord corporate chain. He got hired by a decent one. But here's the deal. So you remember, I knew this guy when he was private. I knew him for a long time when he was independent. And he's not even belly aching to me. He's not complaining to me. I'm simply listening to what it's like. So, he goes in and starts practicing. And he goes in to do a hygiene check, for example, and the patient, in his opinion, needs scale and root planing and needs some ancillary therapy with different agents that we can use and chemotherapeutics that we can use to reduce plaque activity, etc. I don't need to get into specific products at this point. And, remember, this isn't his practice anymore. He's an employee. And he's got a great rep. I've heard it. And he's got a great chairside manner. And the response was from another staff member, well, we have to check with insurance because they were scaled 2 years ago. I mean, that maybe doesn't sound like a big deal to you listening to me right now. That would freak me out. Do you know how many patients that come to me that were allegedly scaled and root planed, or even not allegedly, they were scaled and root planed 2 months ago, but somehow they're in my office. Hey, I don't mean to be, so down home right now, but it is what it is. And I've gone on these podcasts a number of times and I've said to you, one of the lines I draw in the sand that I won't overlook is a lack of optimal periodontal health. That is, at least attempting to maintain periodontal health. Maybe they can't afford laser therapy. Maybe they can't afford open flap curettage and guided regeneration techniques. But for goodness sakes, we can certainly scale and root plane them and put them on and insist that we have them on a 3 or 4 month recall. And that is certainly better than doing nothing. And who gives a what that they were cleaned or scaled 2 years ago or 1 year ago or in my office? I don't care when it was. If the tissue bleeds when you look at it, if it's puffy and edematous and it's not healthy, it's not healthy. And I'm not be a little bit done with you yet. And then the other thing is, look, maybe I'll get a lot of bad emails off of this and maybe I'm out of line. I'm sorry. I'm going with this podcast. Because what it means to me, for those of you out there right now, in riding to the gym or going to work, and you're in a similar, I refuse to believe this is the only associateship relationship that exists out there where you lose so much control over what you once had. And in your case, what you've never had. So I want to tell you how beautiful it is when you have full control, man. When you can do, and I'm sure, by the way, I shouldn't say all associateships are like this. That would be wrong. But you better, when you take on an associateship, you need to negotiate. I've never even thought about this stuff until tonight. You need to negotiate what you're able to do and not do. So, for example, this doctor also mentioned to me that, well, what about the labs? Now, naturally, your associate, the doctor that owns the office that you might work for, or if it's a corporate chain, I would be more inclined to believe they have a dedicated lab because they have a dedicated deal that the regular independent guys like me can't get with that lab. That's fair. But what if you want to use a different lab? I use a different lab for my interior aesthetics than I do number 30 or 31. I don't have to pay $400 a unit for number 30 or 31 as long as the margins are good and it's within my reasonable standard of care. I'm not talking about sending it to a place for $49. I'm talking about I have different labs, which I think a lot of guys do. But what if you didn't have that control? What if you had to use the lab of where you went to work when you knew there was other labs? What if it wasn't even a good lab? It wasn't even within your standards of care. I have a problem with that. And so everything I am coming up with right now is directed towards reminding you of how it's going to be different for you if you're not out there yet. And I guess on the other hand, if you're thinking of giving up your independence and merging, that's okay too, as long as you vet these things I'm talking about. You know, if you go into, which I believe is the case with most corporate-based dentistry, if you go into it and it's an insurance-driven organization because they know how to work the insurance, let's be honest, they can get better deals, they can get better payments on different procedures than you can get if you're independent like I am, because they have that kind of power. So let me just back up where I'm at right now. So I'm talking about, do you have the freedom of whatever lab you want to use? The answer would be no. Are you going to all of a sudden be locked in this insurance-driven philosophy that you know I'm so against? How could anybody support an insurance-driven philosophy? When on earth can anybody make an intelligent argument with me that the type of insurance and the maximum of that insurance dictates the care of a patient? How does that even equate to anyone? I've said it already in this podcast. It is what it is. They come in and they need 4 root canals. If they really do need 4 crowns that can't wait, maybe they're crowns on root canal teeth with recurrent decay like I saw last week. And this patient is not a candidate for implant dentistry. And they really want to keep their teeth. I mean, don't you run into just a number of possibilities that are endless when it comes to individual patients, what they need, and treatment plans? So how could you ever say what I just alluded to could not happen? It could happen. And so what's going to happen in that corporation, in that corporate influenced office that's insurance driven? They're going to say, well, we're going to have to do 2 now. Well, what if you wanted to splint them? Because that was another property, not that I almost ever splint teeth, unless it's maxillary implants. What if, in that case, you had to splint them because that was their only possibility of maintaining 4 or 5 or 6 teeth because of really bad biologic tooth structure that remained? And this would be an added benefit. It's going to influence your treatment plans. What type of insurance they have is going to influence your treatment plans. And let me tell you another thing that happens that would devastate my case acceptance. That would be, I would lose the ability to create goodwill with my patients. So let me give an example. If you're an insurance-driven practice, then you can't throw in nice things for people if they're going to have a big case. So let's think of something for a minute. Let's say a case I'm going to do, and it's a very big case, north of $20,000. And in this case, the patient needs a sinus lift. I will tell you, in my neck of the woods, which I think represents a lot of America, challenged economic areas, I know I don't have the other practice located in such a arena. It's all over the United States. So when you can add value sometimes to these cases, like I'll need to do a sinus lift. Well, a sinus lift to my office, full boat, can be $3,400. But if the patient's having 6 additional implants and a fixed prosthesis, and the price is, very, very up there, it wouldn't be past me at times to do the sinus lift at cost of materials. Well, if you're insurance driven, you can't do that. It's legally not allowed to do that. Not to mention all the other things you can do that you won't be able to do. When I have a patient that needs full mouth extractions, and there really are surgical extractions, I could really legitimately qualify a number of the teeth as surgical extractions. I would lose that ability to call them simple extractions because they are what they are when it comes to insurance company. You can't change from one patient to the next if you're locked in which is why I'm so anti-insurance. I don't know if this is coming through. I don't know if you can hear in my voice that I am, and this is after a work day, by the way, I am razzled up. I'll tell you that. I am, because it just offends me. It's against all the reasons I've been talking about for 52 weeks. Why would you take all the CE if you can't really treatment plan the way you're supposed to treatment plan, or that you've learned to treatment plan? And what are you going to do? Use just any lab because, well, that goes with the company you joined? I mean, at least have the privilege of, and think these things out, or write to me before you agree to an associateship, or for goodness sakes, join a corporation. And I guess there's some out there. I don't have the right, because I don't know the ins and outs of every corporation, dental corporation in America. And I certainly believe there's probably, I know if you're an associate of mine, none of this is even relevant. In fact, I want exactly for my associate what I want for me. Or the way you even close a case. I mean, I've put so much energy and effort into a number of these podcasts talking about how you close a case. And why would I talk like that? Because I'm trying to rip the patient off? Because I'm trying to talk them into something? No, man. We chose an elective profession where people do not have to restore their whole mouth to live. They don't even need most of their teeth to live. Yes, they'll get GI problems, but they probably have GI problems anyhow from the foul diet that so many people follow. Yeah, I'm not too upset tonight, right? Now I'm getting on the American dietary habits, which would include mine, by the way. I just had a Hershey chocolate almond bar. Yeah, I'm certainly not vegan yet. So here's my point. I'm upset because I represent the average guy in dental school. I was not anywhere close to the top half of my class. And I made a lifetime commitment to education because I loved it. I loved getting better, like all of you. And it translated into this exceptional practice and professional life that as a result, that I've created, in spite of the fact that, like many of you, I'm located in an area that makes it pretty hard to do what I do. And the reason it's happened is because of everything I just said to you. If I never took the CE, if I never improved my skills, I wouldn't have met other fabulous clinicians and other much better entrepreneurs and businessmen than me, who I picked pearls from when I was out there all across the United States taking those courses. I wouldn't have met a lot of them. And I wouldn't have assimilated a lot of the things into running my practice that I probably picked up from a lot of them. And the art and the beauty of comprehensive treatment planning that I picked up, because you'd want a comprehensive treatment plan as you take more and more CE. And you would understand the indignity of being forced not to practice that way because you are locked in an insurance-driven practice. So yeah, we practice in an elective profession. We are not working solely on people who had a heart attack 2 hours ago and have no choice about what they want to do next. Or brain surgeons. Let's just be real here. We're more like plastic surgeons, quite honestly. They don't have to do everything that we recommend. So yeah, if you want to have this practice and fulfill your potential and put out there all these skills you have, which you should want to do because too few of your comrades in our profession care that much. How do I know that? Because I've been doing this 39 years and I've met tens of thousands of dentists. And what I just told you is true. If it wasn't true, then why do so many patients qualify for FMXs that walk in your practice? Almost everyone. Not in my practice. If my practice patient left, because an FMX or a CT or a PAN is part of a complete diagnosis, certainly every 5 years. Yet, the majority of them have those insurance benefits available because somebody's not doing it. Most people practice myopic dentistry. I get it. But that's not what this podcast has been about. And it all came full circle tonight in a phone call because I recognize the real life situation and what it's like to not have independence. And I'll close with this. Feels a little bit like a sermon tonight. I'll close with, let's think of the possibilities right now. You got out of school in the last 5 years. You're in an associateship that you have a lot of freedoms that I'm saying that maybe you don't have. So good. Guess what? It's going to get even better. When I am a voice, always been a voice, and I'm especially one tonight, of independent dentistry, meaning you go to work every Monday and decide how you want to live your life as a dentist professionally. If that choice is to be insurance driven, then that's your choice at least. But when you get into a situation where, because you're an associate, that you have no freedom, or the practice was overtaken by a corporate monster, that all of a sudden the freedoms are gone, that's not even practicing dentistry anymore. You know, you're a shoesmith. Is that even what it's called? It's late. It's after work. You're a shoe repair person. You're something else. Not what I'm getting you to aspire to. Let me tell you something. I'm in this now a long time, 39 years. And it certainly isn't the money that drives me anymore. I don't even know if it ever was the money. I think what drives me is knowing I was good at it. And being good at it led to a lot of nice things, you know, being valued, being recognized. I opened up a patient today to do an uncovery over an implant I did. And lately I've been on a roll. And I don't feel funny telling you that because sometimes even good dentists go into slumps. And it just looks like whatever I was doing 4 to 6 months ago and all the uncoveries I'm doing, the bone is like out of a textbook. It just makes me so proud. And I wouldn't be doing that stuff if I had to worry about whether it was covered by their insurance, you know, or crown lengthening procedures that I get to do. And sometimes I throw them in, by the way. I talk like this because you know by now this is what I'm like. I'm authentic and I'm real, and I don't apologize for it. But tonight came from an unexpected stimulus. I didn't expect even to do one of these tonight. And I wanted to do it while it was fresh. So follow this one up with questions. And if you have a specific situation that you're in, I can at least tell you the questions I would ask. And I don't know if I could have done that before the conversations that I had today. You know, work hard for your independence. Take a lot of CE. I mean, if you like being a dentist, that is. I mean, if you want to be this thing you signed up for some years ago at the highest level and fulfill your potential, then I'm the one you should be listening to. So tune in next week. I'll be less fired up, or maybe I won't. Maybe I'll be worse. Until then, thanks for joining me on The Lionhearted. Dr. Steve Rasner here saying, have a good week.